tonight we have a special guest with us. So I am Dr. Heather Moore, owner of Total Performance Physical Therapy, and that right there is my niece Kennedy. So she's going to be helping out tonight with our video because we are going to go over some really important tips for moms. While she is not mine, I do have 3 of my own. So she's just, yeah, it's pretty, yes. So there's going to be a little interruption in this video. But one of the things that we need to concentrate on as moms is a lot of us suffer from hip pain, back pain, neck pain, shoulder pain because of our lovely children. And most of it is posture related. So we're going to go over some things about posture when pertaining to toddlers, and I have a toddler here, so we have a real life example of exactly what you need to do. So one of the things that makes us as moms very good candidates for the herniated disc is this type of posture here where we're constantly bending over. This is the perfect height because she just started to walk a few months ago, and she'll come over and you bend over. So this is the most pressure you can put on your discs, and actually my back just hurts just bending over like this a couple times. So what can you do about that? So one of the things that you can always do is, and I know that mom's like, oh, it's not practical, but you really have to take care of yourself. So what you want to do is you either want to get down on one knee, and I know that's not always practical, especially when you're doing 10 million things, or if you're just trying to appease the child, you just want to reach down with your hand, okay? So you don't actually do this 100 times. So you're either going to squat, you're going to kneel, or you're just going to reach down, okay? This is the posture that you need to avoid, especially if you're suffering, especially if you're suffering with back pain, because that's going to herniate your discs. That's going to cause you a lot of pain. If you have given birth just recently, all right, it's really important that you put the carrier up on something elevated so you don't have to bend over and pick up the carrier. It's super important if you just gave birth and you have somebody that age or a little bit older that you are constantly doing this because you've just given birth. Your core is not intact. It's a mess. I've been there, I know. But what happens is now instead of bending over and having a little bit of core support, there's nothing there. So you're really putting a tremendous amount of pressure on your discs as you bend over. So just a quick thing when you're a mom and you have to continually appease people who are about this height, you want to just try and reach down with your arm as much as you can, bend from your legs. It is not going to happen overnight. It is something you're going to have to practice. As soon as you get used to it, it's going to be easier. It's going to be very cumbersome in the beginning. But if you are someone who has back pain or piriformis syndrome, these are types of things that are only going to aggravate it. So you have to change your behavior. Doesn't matter what type of pills you take. Doesn't matter what type of therapy you're going to. It doesn't matter. If you don't change the behaviors and you don't change what you're doing every day, then you're going to have some issues with your back that are not going to be resolved. All right, so the second one is, and cheese, here she comes. So this is the popular one. And we always wind up holding the baby on our hip like this, okay? So she's not going to stay on there, but that's, everybody's got the gist. So you wind up doing this with your toddler, your baby, whatever. This actually shifts everything over either to the left or to the right, whichever hip you hold them on. Most of the time it's on the left, so you're able to do something with your right hand. If this is a position that you find yourself in often, you do have to purchase one of those slings, something to hold your baby, okay? Shifting over like this, holding like this is going to put stress on your nerves. If you have numbness and tingling in your fingers, if you have numbness and tingling into your toes, and you're doing this, and I know how long you can be like this without even realizing it if you're trying to do something on the phone or just trying to hold somebody while you're getting something done. Really important that you make sure that you are not doing this for an extended period of time. They make a lot of wraps now. They make a lot of slings. They make a lot of different things that you are able to offset your child onto your hip but remain standing upright. Again, if you suffer from back pain, you can't fix it if you're just going to do this. Now, another thing you can do is just hold them right in front of you, okay? So your posture, yes, I know, you want to get down. So your posture is nice and straight, okay? You're not doing anything. You actually get a little bit of a core workout. You can turn them around. Nope, she's not going to let me, but you can, okay? So And they're tough at this age because they wiggle a lot. So you do want to make sure that you are not allowing them to be on your hip and kicking and wiggling, because your back and your discs are absorbing all of that. So if you go to bed at night and you're like, my back is killing me, or you suffer from numbness and tingling, and you allow that to occur on your hip, that's a major issue, okay? So you want to make sure that you take care of that. They're either here or you're standing up straight and they're here, okay? Another thing that you want to do is when you are going to interact with your child, you want to get down on the floor as much as possible, and you want to sit on the floor, all right? So you want to come down to their level and you want to sit. Nice and easy. This is the best way for you to interact posture-wise on their level, right? Can I have that? You're going to snap yourself. Thank you. Thank you. So this way you're able to sit in fairly good posture and still be at their eye level. These are things that you have to be aware of and that you have to watch every day. A lot of times, especially if you have an infant and you're carrying your infant a lot, you're going to shrug your shoulders, okay? As Kennedy was moving around and trying to get out of my arms, you saw a lot of my upper traps come into play, okay? You have to stay relaxed. Again, you're going to herniate your discs in your neck and your shoulder. I treat lots of moms of 4 or 5 kids who have these horrendous shoulder issues on one side, and it's from doing this. It's from holding them like this. It's from doing this for so long that now it's become a serious issue. There are certain postures you cannot avoid, and I completely understand that, and I get this. This is not a non-busy mom telling you this is how exactly it's going to go. I mean, there's some days we don't even get dressed. Life's so crazy. So, but what you need to do is when you have a minute, you need to start reintroducing the correct way to stand, the correct way to move, the correct way to sit, the correct way to bend and get things from your child. That way, you can help alleviate some of that pain.